Welcome to the WION podcast, where we explore fascinating stories and ideas from various fields. In this episode, we explore India's food safety crisis as contaminated and ultra-processed foods threaten public health, revealing the hidden risks behind what ends up on our plates. Because this isn't just about what we eat, but about how deeply it shapes everyday life across the country. Across India, food is deeply connected to culture, tradition, and daily life. Yet an uncomfortable reality is emerging. Many commonly consumed foods are increasingly compromised by adulteration, contamination, and excessive industrial processing. What was once viewed as isolated malpractice is now being recognized as a systemic vulnerability within the modern food supply chain. Milk, paneer, spices, vegetables, eggs, meat, fish, and packaged foods, items consumed daily by millions, are under growing scientific scrutiny. Public health experts warn that unsafe food exposure is becoming a major contributor to non-communicable diseases, NCDs, including diabetes, cardiovascular disorders, and cancer. This is a study by Dr. Naval Kumar Verma, MD, Hon PhD, Doctor of Science, Global Wellness, Ayush, and a food safety expert. Food adulteration in India is no longer limited to sporadic incidents, as surveillance reports, food testing data, and regulatory findings reveal recurring lapses at multiple stages of production and distribution. Products that are frequently flagged include milk, curd, paneer, and ghee, spices and blended condiments, fruits and vegetables exposed to pesticide residues, eggs, poultry, meat, fish, and seafood, as well as packaged and processed, ready-to-eat products. The concern is structural rather than individual. From animal feed and farm inputs to processing facilities, cold chain storage, and retail handling, weaknesses across the supply chain allow contamination risks to persist. Scientific assessments have reported antibiotic residues, hormonal growth stimulants, and microbial contamination, including Salmonella and E. coli, in egg production systems. Chemical traces originating from poultry feed further complicate safety concerns. Chronic exposure to such residues may contribute to antimicrobial resistance, AMR, disruption of gut microbiota, and persistent low-grade inflammation. In many industrial systems, antibiotics are used not only for treatment, but also for growth promotion. Excessive or irrational use increases the risk of antibiotic-resistant bacteria entering the human food chain. Inadequate slaughter hygiene and the addition of chemical preservatives to extend shelf life add further risks. The World Health Organization recognizes antimicrobial resistance linked to animal agriculture as one of the most serious global health threats, affecting infection management and modern medical care. Reports frequently highlight artificial preservation using chemicals such as formalin, as well as contamination from heavy metals, including mercury and cadmium. Fish sourced from polluted waters may accumulate toxins over time, posing neurological, hormonal, and long-term cancer risks. Beyond contamination, another major concern is the rapid expansion of ultra-processed foods, which, whether vegetarian or non-vegetarian, are typically characterized by refined carbohydrates, industrially modified fats, high sodium content, synthetic additives and stabilizers, and low fiber and micronutrient density. Research increasingly links high consumption of ultra-processed foods to obesity, insulin resistance, fatty liver disease, cardiovascular disorders, and certain cancers. Large international cohort studies suggest that these risks persist even when total calorie intake is controlled. Ultra-processed diets can alter gut microbiota composition, promote abnormal fat storage, and accelerate biological aging. Food adulteration should not be viewed merely as a regulatory violation, as repeated low-dose exposure to contaminants acts as sustained biological stress on the body. This chronic biological burden triggers key mechanisms such as oxidative stress, endocrine disruption, chronic systemic inflammation, DNA damage, and impaired immune response, gradually weakening overall health over time. These pathways form the biological foundation of many modern chronic diseases, including autoimmune conditions, infertility, neurodegenerative disorders, and cancers. India is experiencing an earlier onset of diabetes and obesity, an increase in hormone-related and digestive cancers, and a surge in non-alcoholic fatty liver disease. While genetics play a role, environmental and dietary factors are central drivers. International health agencies emphasize that unsafe, ultra-processed, and contaminated food systems are closely intertwined with the global epidemic of NCDs. The growing burden of chronic disease suggests that food safety must be treated as a preventive healthcare priority, not merely a commercial regulation issue. Countries with stronger public health outcomes adopt comprehensive food safety strategies as part of global best practices in food governance. These measures include rigorous monitoring of antibiotic residues, farm-to-plate traceability systems, rapid recall and food alert mechanisms, clear front-of-pack nutritional warning labels, and restrictions on the marketing of highly processed foods. These measures recognize food as a public health intervention rather than solely a market commodity. Nutritional policy must prioritize purity, safety, and long-term metabolic outcomes, not just caloric availability. Animal-based foods should adhere to strict residue limits and responsible farming standards aligned with human health protection. Industrial formulations that disrupt endocrine and metabolic balance require stronger regulation and consumer awareness. Traditional dietary systems emphasize seasonal eating, digestive strength, and individual constitution. Emerging microbiome and systems biology research increasingly validates these principles. While healthcare systems focus on managing disease, food policy has the power to prevent it, especially when it comes to cancer prevention. Citizens can play an active role by choosing fresh, minimally processed, and traceable foods, limiting the consumption of packaged and processed meats, reducing refined and high-carbohydrate packaged products, supporting responsibly sourced and antibiotic-free animal products, and demanding greater transparency, testing, and stronger enforcement from authorities. Thanks for tuning into this incredible story. If this episode resonated with you, don't forget to hit the like and subscribe button for more captivating stories to come. Stay tuned.